in our community. Release your burdens. Talk to partners. Unforgiveness, it is now, I've known this for years, but now medical providers, we are now talking to patients about the fact that they need to release their emotional burdens because it's impacting their health. How many of you know someone who had cancer, and how many of you know someone who has cancer or being treated for cancer or had cancer? Now, if you go, let's say, for example, prior to working at a mental health institution in Miami, there's a hospital called Joe DiMaggio. And one of the things that they have on their pediatric ward is they have dogs. They have dogs that go into the room at certain times of day to keep the patients, the pediatric patients and the children happy. Because when there's an increase in dopamine and serotonin, that expedites the healing process, right? The second tower, lifestyle changes. Please, you don't need a prescription for a machine. Especially during COVID and the times that we are living in, don't wait to get a blood pressure monitor. If you are an adult, if you are of age, I see some of you can take a picture, please go to Walmart, go to Walgreens, get a blood pressure monitor. And especially if your loved one is a diabetic, they need to be testing frequently, right? Exercise, we talked about that. Sharing your family history. And then last but not least, HIV management. Keep hard candy. So if you have a loved one who's a diabetic, they should have what on them? Candy. Because it helps with what? Bring the sugar up. Because some people do experience, depending on what medication they are taking, some people actually experience their sugar level dropping really low, and they get dizzy and they get fatigued and they pass out. But if you have hard candy on hand, that can bring the sugar levels up immediately. We talked about the pharmacist. Again, if you are taking antibiotics, you should always complete the therapy, right? If you start one, if you have a side effects or if you have an allergy, call your pharmacist and let them know so we can make a note in your profile. But you never want to stop taking antibiotics midway, because then that makes you more susceptible for the recurrence of that infection. All right, practice self-talk. How many of you practice self-talk? Like you encourage yourself in the mirror, on your way to work, someone made you mad, your colleague stressing you out. Lord Jesus, if I get another text message. How many of you had those kind of coworkers? She said in the car. We gotta practice that, because again, that also contributes to us being stressed, because we're not talking to people. We're not confronting our